Prepare STL presents What Matters to Me Most with Dr. L.J. Punch, trauma surgeon and founder of the TSTL. Learn more at preparestl.com.
Hi, I'm Dr. L.J. Punch, trauma surgeon and founder of the T, a community of health working to reduce the impact of trauma in the St. Louis region. I'm at the T today, and I'm really excited to invite my friend, Dr. Liang, to talk to us about something that's really on people's minds right now. The new Johnson & Johnson vaccine. What does it mean? How is it going to impact us, and is it safe? We're also going to talk a little bit about new concerns about COVID-19 and the unique ways in which this is impacting people who aren't secure with a home. Can't wait to hear what Dr. Liang has to share with us today.
What matters to me most?
Dr. Liang, thank you so much for coming to the T today to talk to me. I appreciate it. Appreciate your time. How are you doing?
Great. It's a privilege to be here. Thank you.
You know, you and I go way back.
We
were residents together.
We do.
In Maryland, and then we've worked together here in St. Louis. You are like a multi-layered doctor. You practice a lot of different things. Tell me a little bit about your practice before we even get into this.
Sure. So I do a combination of both emergency medicine and infectious disease. That's the way I trained. Obviously, we trained together at the University of Maryland, where I did emergency medicine and trauma medicine, and then now infectious disease.
Wow. So not only can you save somebody who's bleeding to death, but you can, lead an organization through a pandemic.
It's hard to say.
No, just, again, really appreciate it. So, listen, there's a lot of buzz right now, and people are really worried about what the new vaccine that's on the scene and the FDA approval for that vaccine means for our community. So tell us a little bit about the Johnson & Johnson vaccine. How is it different? What does it mean? And what role is it going to play?
Absolutely. So obviously you've heard a lot about this third vaccine that's come through the pipeline, the Johnson & Johnson or Janssen vaccine. It's a little bit different than Moderna and Pfizer vaccines, but the same concept. It kind of basically allows your body to respond to that spike protein, build the spike protein, and develop immunity to it, so you can then repel an infection from the virus that causes COVID-19 later on. What's different about it? It is a single dose, so that's a really attractive part of this vaccine as opposed to Pfizer, Moderna, which is 2 weeks, which is 3 to 4 weeks apart, 2 doses. As far as the efficacy, there's been a large study. Obviously, these studies were all done in different parts of the world. The Johnson & Johnson vaccine was done in parts where there were actually a lot of case numbers for COVID-19, and they saw an efficacy of about 66% in terms of preventing severe disease with COVID-19 or hospitalization, which are really the things that we worry about when it comes to COVID-19.
So I really want to hone in on that, right? So you said a lot of really important things. So similar to the first two vaccines we got, this vaccine makes your body respond to the spike protein.
Yes.
What is the spike protein?
So the spike protein is that part of that virus that allows it to attach to a part of your lung. We know that COVID-19, that virus is transmitted through the air, through droplets, through the respiratory system. Just when someone inhales a droplet or something, that virus enters the lungs and attaches to a cell within the lung and then causes infection.
So this is like a really important part of the virus that lets it do what it does to infect our cells.
Exactly.
Okay, so it's the same thing in the Johnson & Johnson vaccine as it is in the first two vaccines we saw.
That's correct.
The other thing I want to understand is you say it's one shot instead of 2 shots. Why?
That's a great question. A lot of it probably has to do with the immune responses generated by the vaccine. It's just the way that it was studied. So, with these tests, when they go through the first and second phase trials for clinical trials, they look at how long the immunity lasts in healthy volunteers. And they probably arrived at that dose, that one single dose based on those studies.
So basically, without a second shot, this vaccine will give people a certain amount of protection based on the studies at how many months later?
That's, unfortunately, those studies are still very fresh. So a lot of these studies are like in the last 6 months or so. So we have about 6 months of good kind of randomized clinical trial data. So we're going to find out. We're going to find out over the next couple months, a year, how long the immunity is.
So there is some unknowns, the same way we have about the first, now we have about this. And then the last thing I really want to make sure I understand is this one you said has about a 66% impact. What does that mean? And how does it compare to the Moderna and Pfizer?
And that's a really important point. So this vaccine and the Moderna and Pfizer vaccines were never studied head-to-head, meaning in one trial, in one place, with the same patient population and so forth. It's known that the Johnson & Johnson studies were again done in areas with a lot of cases of COVID-19, and as a result, there's a lot of transmission. So their risk of infection or exposure to infection was, very different compared to what we saw with the Pfizer and the Moderna vaccine.
So basically, you're comparing two teams on a totally different field.
Exactly.
And so we can't necessarily hold on to that too much.
That's correct.
Okay.
Yeah.
But okay, so then let's understand, what kind of protection does the vaccine offer based on those results?
Yes, so we know that, so the way the studies are designed again are to look at how many people end up with infection with SARS-CoV-2, the virus that causes COVID-19, and end up in a hospital. So requiring oxygen, requiring intensive care unit, or even maybe even a ventilator. So really bad disease with COVID-19. That's the way these studies were designed to look at. We do know that most of these vaccines, we do hope, will also prevent infection altogether. We just don't have the proof just yet.
Okay, so basically this helped keep people out of the hospital.
Exactly.
And it sounds like the first few vaccines honestly did, based on the studies, which were not done on the same playing fields, so maybe apples and oranges, different kinds of results might have been the way they were studied. But in the one study, we saw maybe about 9 out of 10 people be protected from going into the hospital. And then in this study with the Johnson & Johnson, it's maybe down to like 7 out of 10.
Exactly.
We'll be right back. Learn about the pros and the cons of the COVID-19 vaccines. Visit preparestl.com to get the facts. Remember, the choice is yours. Prepare STL, helping St. Louisans of color prepare and prevail. What matters to me most is transparency. Do I have fact-based information?
Hi, my name is Julia Ho. I'm with St. Louis Mutual Aid, and when it comes to the COVID-19 vaccine, what's most important to me is that people have a clear and consistent way of getting their questions answered from medical professionals, from people who are going to be distributing the vaccines, and that they have a way to communicate and to get their questions answered, as well as to address concerns that come up in the distribution or after receiving the vaccine.
This is What Matters to Me Most with Dr. LJ Punch, trauma surgeon and founder of the TSTL.
So what about side effects? Was there a difference in how likely the new vaccine is to cause different or more severe side effects?
Side effects are very similar to the Moderna and Pfizer. So muscle ache at the site where you get the injection. As far as other symptoms, all very, very minor. Obviously, this vaccine is just rolled out just approved, emergency use authorization approval about a week ago. So we'll find out as it gets rolled out as far as whether there will be any significant number of side effects, but it's not anticipated based on the studies. They're pretty infrequent.
So right now, the information we have is that it's similar.
Yes, exactly.
But even with the first set of vaccines, there are some, not just side effects, but complications.
Yes.
I actually just saw a report, the adverse event report, which the way I understand it, that basically means that every time something happened after someone got the vaccine, that they got sick in some unexpected way or whatever, it got related to the vaccine, and we really don't know did the vaccine cause it or not, but yet it happened. It's a lot of those events. How are we using that information about those things, which are some of them pretty serious, even people quite honestly dying? How are we using that information, and how can we understand it?
So I think the first thing to underscore even with those early vaccine adverse event reports is The good news is that we're talking about usually in the double digits number of cases among the millions of doses of vaccines administered, so extremely infrequent. That being said, there are many things that we can learn from this, and part of that is that if someone has had a prior reaction to a vaccine, say a flu vaccine or another vaccine, we might be a little bit more careful about whether or not we want to vaccinate that person, as opposed to look for alternative means to protect them. I think that's one way. We know that many of the people who had problems with Pfizer and Moderna vaccines had prior reactions with vaccinations as well.
I am telling everybody I can this bit of advice. If you've had a severe allergic reaction, if you have a history of anaphylaxis where you have to carry an EpiPen, or you're the kind of person that has to know if there's like a peanut or a scallop in your food, like those folks who have that history really do need to check in with their doctor before making that decision.
Exactly.
Yeah, and so you would say that's the same, perhaps, advice that you would give somebody for the Johnson & Johnson.
Absolutely.
If they're considering it.
Yeah.
You know, there's nothing more powerful than understanding the risks and the benefits when you're making an informed choice about the role the vaccine can have in your life. And you alluded to just now the fact that there are other things that we can do besides the vaccine to protect ourselves. What are some of those things?
Well, really kind of similar, simple strategies that we've used over the last year, which is washing our hands, obviously, wearing a mask, social distancing, physical distancing. All those things we know can prevent the transmission or spread of the virus within air from person to person.
So those things are still just as important today as they were a year ago when this pandemic was starting.
Exactly.
Yeah. So another question then, let's change gears. A lot of people are worried about the impact of these new strains, the variants. How are you thinking about that when you think about COVID now, a year later?
Absolutely. So, I mean, this is the variants are a pretty complex part of this virus, and it's actually believe it or not, this is a natural part of the evolution of viruses in general, is that over time they develop ways to become more effective in terms of infecting human beings and so forth and transmitting from person to person.
So they're like an iPhone got to remake themselves every year. Exactly. iPhone 1, 2, 3, 4. Yeah, they just keep coming with new stuff, right?
Exactly.
Yeah.
So, with the variants, we know that they've evolved to the point that they can transmit a little bit more effectively from person to person, but they don't necessarily cause a different type of disease or a more severe form of disease. Mm-hmm. It's just that they transmit a lot easier. And for that reason, we have to continue to use a lot of the things that we've been doing, again, with the masks.
Same answer. Yeah, right? Exactly. Same thing.
Yeah.
So even with the variants, the bottom line is you can protect yourself by using those simple tools.
Exactly.
There's folks who are among us who have been dealing with all of this stuff, variants and COVID and all this stuff, who haven't had the protection of a home to keep their hands clean, to keep themselves covered, to keep distance from other people, or people whose housing has been threatened by this. What do you think about when you think about how we can support folks who are unhoused or housing insecure through this pandemic?
And that's a really challenging one. I mean, we recognize that resources are needed in order to provide shelter and ability to protect oneself from other individuals who may be carrying the virus and transmitting and so forth. I think one of the things that we can do, the city and other places have looked at in terms of trying to open up more housing or to, as far as a moratorium on evictions and other kind of strategies, because this is a difficult time for everyone across the board. A lot of people are out of jobs, having difficulty even putting food on a table. I think we can support those very basic things. I mean, a lot of unless you solve the basic fundamental challenge that a lot of these persons are facing, which is housing, shelter, you're not going to be able to address the other health issues.
It's almost like I hear you saying housing is healthcare.
Yeah, absolutely.
Final question. What are you the most worried about right now? And what is also still giving you the most hope?
So I think the thing that worries me the most is, well, I mean, we are seeing that cases are coming down. So that's really great news, is seeing the hospital starting to empty out, fewer and fewer sick patients in the ICU. Even the COVID wards are getting a little bit thinner than they were before. So we're seeing less severe disease or people hospitalized for COVID-19, but I don't want people to let up their guard. This is the time when we have to keep pressing onwards as far as preventing additional transmission, thinking about other strategies to prevent infection in general. And, we recognize that we wear masks for each other, and the vaccine it's a decision for ourselves, a decision to protect ourselves, and I think that I would like people to weigh all the options and understand the data, ask questions about the vaccine, and make an informed decision about the vaccine.
I love that. So it's basically we might look like the other team is losing, but the game is not over.
That's right.
And we need to make responsible choices for ourselves. But the decision to wear a mask is a simple thing
Yes.
we can do to serve each other.
Yep.
I love that. I love that. Well, thank you so much for your time, and thank you so much for helping us keep informed.
Absolutely. Thank you. I appreciate the opportunity.
What matters to me most?
We need to understand and be ready to make a decision for ourselves that comes from accurate, good information. That's what I heard today, but that also, no matter what decision we make, we can make simple choices to serve our community by continuing to have covered faces, be at a distance, and keep with hygiene. I think those 2 points are so powerful. They're points that anyone can take advantage of, and points that we need to make sure we're supporting folks even that might not have everything they need on a day-to-day basis to be able to make.
What matters to me most is a presentation of Prepare STL. Prepare STL is a collaboration powered by the Missouri Foundation for Health in partnership with the Regional Health Commission, the City of St. Louis County, and other community health organizations to help prepare all St. Louisans for the effects of the COVID-19 response, how to stop its spread, and how to survive the pandemic physically, emotionally, and economically. Don't miss an episode of the What Matters to Me Most podcast with Dr. LJ Punch, trauma surgeon and founder of the TSTL, for the latest conversations on COVID-19 and STL, vaccines, racial health disparities, physical and emotional well-being, and more. Download the podcast at preparestl.com or wherever you get your podcasts. Executive producer, Vector Communications. What Matters to Me Most is another positive production of Rare Gem Productions.